Hello, future doctors, nurses, and healthcare heroes. Today we're diving deep into one of the most fascinating and vital organs in the human body, the kidney. Think of it as your body's master chemist and purification plant, working tirelessly 24/7. It's an unsung hero that often doesn't get the spotlight until something goes wrong. But for you, as a medical student, understanding its intricate design is fundamental. This knowledge isn't just for passing exams. It's about grasping the core principles of human physiology and pathology. The kidney is central to so many bodily processes, from blood pressure regulation to red blood cell production, making it a cornerstone of your medical education. So, why should you be so invested in learning about this bean-shaped wonder? Because practically every patient you will encounter will rely on healthy kidney function for their overall well-being. A compromised kidney can have a domino effect, impacting the cardiovascular system, bone health, and even neurological function. As you progress in your studies, you'll see how kidney-related issues pop up in almost every specialty, from general practice to intensive care. Mastering its anatomy now will provide you with a solid foundation, allowing you to connect the dots later on when you're faced with complex clinical scenarios. It's about building that mental map of the body, piece by piece. In this guide, we're going to break down the kidney in a way that's easy to understand and remember. We'll strip away the complex jargon and focus on the core concepts. We'll journey from its outer layers right into its microscopic filtering units. We will follow the path of blood as it flows in, gets cleaned, and flows out. By the end, you won't just be able to label a diagram. You'll understand why it's built the way it is and how its structure perfectly serves its function. This is the key to true learning, not just memorization. So, grab your notebook, get comfortable, and let's get started on this journey. Remember, every complex topic is just a collection of simple ideas linked together. Our goal today is to build those links, one by one, until you have a complete and confident understanding of kidney anatomy. This is a crucial step in your transformation from a student into a competent and knowledgeable healthcare professional. Let's do this. You've got this, and I'm here to guide you through it. Let's explore the amazing world of the kidney together. First things first, where are these important organs hiding? You have two kidneys, and they are located in the retroperitoneal space. Let's break that term down. Retro means behind, and peritoneal refers to the peritoneum, the membrane that lines your abdominal cavity. So your kidneys are situated behind this lining, towards your back. They sit on either side of your spine, roughly at the level of your T12 to L3 vertebrae. If you place your hands on your hips and move them up towards your lower ribs on your back, you're in the right neighborhood. It's a well-protected position, shielded by muscles, fat, and the lower part of your rib cage. The right kidney typically sits a little lower than the left one. Why the asymmetry? It's to make room for the liver, which is a large organ located on the right side of your upper abdomen. This is a classic example of how the body cleverly packages its organs. On top of each kidney, like a little cap, sits the adrenal gland. These are separate endocrine organs responsible for producing hormones like adrenaline and cortisol. But their close proximity is an important anatomical relationship to remember. So, they aren't part of the kidney itself, but they are very close neighbors. Now, let's talk about what they look like. The classic description is that they are bean-shaped, and it's remarkably accurate. Each adult kidney is about 10 to 12 centimeters long, a bit like the size of a large computer mouse or a fist. They have a reddish-brown color, thanks to the massive amount of blood that flows through them every minute. The surface is smooth, and each kidney has a convex lateral or outer surface and a concave medial or inner surface. This indented medial side is a critical area called the renal hilum, which acts as the main gateway into and out of the organ. The renal hilum is the entry and exit point for several vital structures. Think of it as the main terminal or port for the kidney. Through this slit-like opening passes the renal artery, bringing blood in, the renal vein, taking blood out, and the ureter, carrying urine away. Nerves and lymphatic vessels also travel through the hilum. Understanding the hilum's role as this central connection point is crucial because it's where the kidney connects to the rest of the body's circulatory and urinary systems. It's a busy and incredibly important piece of anatomical real estate. Let's peel back the layers. Externally, each kidney is protected by 3 layers of tissue. The innermost layer is the renal capsule, a tough, fibrous layer that adheres directly to the kidney's surface. Think of it as a transparent wrapper that provides a strong barrier against trauma and the spread of infection from surrounding tissues. It helps the kidney maintain its shape. Outside the capsule is the perirenal fat capsule, a layer of fat that cushions the kidney against mechanical shock. Finally, the outermost layer is the renal fascia, a dense, fibrous connective tissue that encloses the kidney and the adrenal gland and anchors them to surrounding structures. Now for the exciting part, let's slice the kidney open, figuratively of course. A coronal section reveals 2 distinct internal regions, a lighter-colored outer region called the renal cortex and a darker, reddish-brown inner region called the renal medulla. The cortex is the primary site where blood is filtered. It has a granular appearance because it contains millions of tiny filtering units called nephrons. We'll get to those later. The cortex arches over the medulla and even dips down between the medullary structures, forming what are known as renal columns. These columns are structurally important, providing a route for blood vessels to travel to and from the outer cortex. The renal medulla is organized into several cone-shaped masses of tissue called renal pyramids. The base of each pyramid faces the cortex, and its apex, called the renal papilla, points internally towards the center of the kidney. These pyramids appear striped because they are formed almost entirely of parallel microscopic tubules and capillaries involved in urine formation and concentration. They are the workhorses for reabsorbing water and essential salts back into the body, a process that is vital for maintaining hydration and electrolyte balance. The renal columns, which are extensions of the cortical tissue, separate each of the pyramids. Urine, once formed by the nephrons, drains from the collecting ducts through the renal papillae. From there, it drips into a cup-shaped drain called a minor calyx. Several minor calyx then merge to form a larger drainage area called a major calyx. Typically, there are 2 or 3 major calyces in each kidney. These major calyces then join together to form the renal pelvis, a funnel-shaped tube located in the central collecting part of the kidney. The renal pelvis is continuous with the ureter, the tube that carries urine down to the bladder for storage before it is eventually expelled from the body. The kidneys are blood-processing powerhouses. Despite their small size, they receive about 20 to 25% of the total cardiac output. That means with every beat of your heart, a huge portion of your blood is sent directly to the kidneys for cleaning. This incredible blood flow is essential for their filtering function. The journey begins with the renal artery, which branches directly off the abdominal aorta, the body's main artery. As the renal artery approaches the kidney, it enters through the hilum and then begins to divide into smaller and smaller arteries, much like the branches of a tree, to ensure blood reaches every part of the organ. Once inside the kidney, the renal artery divides into segmental arteries. Each segmental artery then branches into interlobar arteries, which travel through the renal columns between the renal pyramids. At the junction between the cortex and medulla, the interlobar arteries bend and form the arcuate arteries, which run parallel to the surface of the kidney. From the arcuate arteries, smaller cortical radiate arteries, also called interlobular arteries, radiate outwards into the cortex. It is from these arteries that the real magic begins, as they give rise to the afferent arterioles, each one feeding a glomerulus, a key part of the nephron where filtration starts. After filtration in the glomerulus, blood exits not into a venule, but into another arteriole called the efferent arteriole. This is a unique and important feature of the kidney's vascular system. The efferent arterioles then lead into one of two different capillary beds. In the cortex, they form the peritubular capillaries, which surround the renal tubules and are involved in reabsorbing useful substances back into the blood. For nephrons located deeper near the medulla, the efferent arterioles form the vasa recta, long straight vessels that run parallel to the loops of Henle, playing a crucial role in concentrating the urine. Finally, the cleansed blood needs to return to the general circulation. The peritubular capillaries and vasa recta drain into the cortical radiate veins. From there, the path of venous drainage essentially reverses the arterial supply route. Blood flows from the cortical radiate veins to the arcuate veins, then to the interlobar veins, and finally converges into the single large renal vein. The renal vein exits the kidney at the hilum and carries the purified blood back to the inferior vena cava, the body's largest vein, which transports it back to the heart. This entire complex loop ensures every drop of blood gets a chance to be filtered. So, while the kidneys can function quite well on their own, they're also connected to the body's nervous system, which allows for fine-tuning of their activities. The nerve supply to the kidneys mainly comes from the sympathetic division of the autonomic nervous system. Now, these nerves actually originate from a network called the renal plexus, and its fibers travel alongside the renal arteries to enter the kidney at the hilum. You can think of these nerves as the communication lines that allow the central nervous system, especially the brain, to influence and regulate kidney function in response to the body's overall needs and environmental stresses. The primary role of these sympathetic nerves is to regulate renal blood flow and, as a result, the rate of urine formation. When the body is under stress, like during intense exercise or in a so-called fight or flight situation, the sympathetic nervous system is activated. This activation causes the afferent arterioles, the small arteries leading into the glomeruli, to constrict. With this constriction, blood flow to the glomeruli is reduced, which in turn decreases the glomerular filtration rate, or GFR. This is actually a protective mechanism that diverts blood away from the kidneys and towards more vital organs, like the heart, brain, and skeletal muscles during an emergency. Beyond just controlling blood flow, the sympathetic nerves also directly influence the process of salt and water reabsorption. They can stimulate the cells of the renal tubules to increase the reabsorption of sodium, and since water tends to follow sodium osmotically, this action helps the body to conserve water and maintain blood volume and pressure. Furthermore, these nerves can also stimulate a very important hormonal system. They can trigger the release of an enzyme called renin from specialized cells in the kidney, which then initiates a cascade of events known as the renin-angiotensin-aldosterone system. Ultimately, this system raises blood pressure. It's also important to note that the kidney contains sensory nerve fibers. These fibers are responsible for transmitting pain signals back to the central nervous system. While the kidney tissue itself has very few pain receptors, the renal capsule and the renal pelvis are actually rich in them. That's why conditions that cause the kidney to swell rapidly, like a kidney stone blocking the ureter or a severe infection, can cause excruciating flank pain. This pain is a critical warning sign that something is wrong, prompting the individual to seek medical attention. And, your future patients will describe this pain, and you'll know exactly where it's coming from. The kidneys do so much more than just make urine. Their functions are diverse, complex, and absolutely essential for life. Their most famous role, of course, is the filtration of blood and excretion of waste products. Every day, they filter about 180 liters of fluid from your bloodstream, removing metabolic wastes like urea from protein breakdown, uric acid from nucleic acid breakdown, and creatinine from muscle metabolism. They also eliminate drugs, toxins, and other foreign substances from the body. This cleaning service prevents the buildup of harmful compounds that could otherwise poison your system. Just as important as removing waste is the kidney's role in regulating fluid and electrolyte balance. They are the masters of homeostasis. By adjusting the volume of water excreted and meticulously controlling the levels of electrolytes like sodium, potassium, chloride, and calcium in the blood, they ensure that the body's internal environment remains stable. This balance is critical for nerve function, muscle contraction, and cellular metabolism. If you drink a lot of water, your kidneys produce dilute urine to get rid of the excess. If you're dehydrated, they produce concentrated urine to conserve water. It's a beautifully responsive system. The kidneys are also crucial endocrine organs, meaning they produce hormones. They release erythropoietin, or EPO, a hormone that stimulates the bone marrow to produce red blood cells. This is why patients with chronic kidney disease often suffer from anemia. They also produce the active form of vitamin D, called calcitriol. This hormone is essential for calcium absorption from the gut and is vital for maintaining healthy bones. Without healthy kidneys, your body can't properly regulate its calcium levels, leading to bone diseases. This highlights the deep connection between the urinary and skeletal systems. Finally, the kidneys play a central role in the long-term regulation of blood pressure. They do this in two main ways. Firstly, by managing the body's overall fluid volume. More fluid in the bloodstream generally means higher blood pressure. Secondly, through the renin-angiotensin-aldosterone system, or RAAS, which we mentioned earlier. When blood pressure drops, the kidneys release renin, setting off a hormonal chain reaction that causes blood vessels to constrict and prompts the body to retain more sodium and water, both of which raise blood pressure. Understanding this system is key to understanding hypertension and its treatments. As future healthcare professionals, your understanding of kidney anatomy and physiology is not just academic, it's profoundly clinical. When these remarkable organs falter, the consequences can be systemic and severe. Kidney diseases are common, and their prevalence is rising globally, often linked to conditions like diabetes and hypertension. One of the most significant conditions you will encounter is chronic kidney disease, or CKD, a progressive loss of kidney function over time. In its early stages, CKD is often silent, with no obvious symptoms, making screening in at-risk populations incredibly important. As function declines, waste products build up, leading to a condition called uremia, with symptoms affecting nearly every organ system. Another common and acutely painful condition is nephrolithiasis, or kidney stones. These are hard deposits made of minerals and salts that form inside the kidneys. While small stones may pass unnoticed, larger stones can become lodged in the ureter, causing obstruction and intense pain, renal colic, bleeding, and infection. Understanding the pathway from the renal papilla through the calyces, pelvis, and into the ureter allows you to visualize exactly where a stone might cause a problem. This anatomical knowledge is crucial for interpreting imaging like CT scans and for planning interventions to remove the stone. Infections are also a major concern. Pyelonephritis is a type of urinary tract infection that has ascended from the bladder up the ureters to the kidneys. It can cause fever, flank pain, and nausea. If not treated promptly with antibiotics, it can lead to sepsis or cause permanent scarring and damage to the kidney tissue, impairing its function. Your knowledge of the urinary tract's continuous pathway from the outside world up to the renal pelvis explains how this dangerous ascent is possible. This underscores the importance of treating lower urinary tract infections effectively to prevent such complications. Ultimately, when kidney function drops to a critical level, end-stage renal disease, or ESRD, patients require renal replacement therapy to survive. This comes in the form of dialysis, which artificially filters the blood, or a kidney transplant. A kidney transplant is a life-saving procedure where a healthy kidney from a donor is surgically placed in the patient's pelvis and connected to their blood vessels and bladder. The patient's own diseased kidneys are usually left in place. Understanding the anatomy of the renal artery, vein, and ureter is absolutely fundamental for any surgeon performing this incredible operation. Throughout our discussion of the kidney, you may have found yourself trying to picture the structures we've been describing. That's a natural and essential part of learning anatomy. Reading text alone is not enough. You need to see it. This is where labeled diagrams become one of your most powerful learning tools. For this topic, there are a few key diagrams that you absolutely must master. First, and most importantly, is a clear labeled diagram of a coronal or frontal section of the kidney. This is your master map of the internal landscape, and you should be able to label it from memory. The coronal section diagram should clearly distinguish between the renal cortex and the renal medulla. It must show the renal pyramids, the renal columns that separate them, and the renal papillae at their tips. You should be able to trace the path of urine from the papilla into a minor calyx, then a major calyx, and finally into the renal pelvis before it exits via the ureter. This diagram provides the macroscopic framework upon which all other knowledge of the kidney is built. Don't just look at it, draw it yourself. The act of drawing will cement the structures and their relationships in your mind. The second essential diagram is one illustrating the kidney's blood supply. This can be challenging, but a flowchart-style diagram simplifies it immensely. Start with the abdominal aorta, branch to the renal artery, and then follow the path. Segmental, interlobar, arcuate, cortical radiate, and finally the afferent arteriole. Then, show the glomerulus, the efferent arteriole, the peritubular capillaries or vasa recta, and trace the venous return pathway. This diagram is less about a physical picture and more about understanding the sequence and flow, which is crucial for physiology. Knowing this pathway is non-negotiable. Finally, while we haven't delved deep into histology, a simplified diagram of the nephron and its associated blood vessels is invaluable. This diagram should show the renal corpuscle, the glomerulus within Bowman's capsule, located in the cortex, and the renal tubule, including the proximal convoluted tubule, loop of Henle, and distal convoluted tubule, dipping into the medulla. It should also show how the afferent and efferent arterioles connect to the glomerulus, and how the peritubular capillaries intertwine with the tubules. This microscopic view connects the large-scale anatomy to the kidney's actual filtering function, bridging the gap between structure and physiology. Congratulations! You have taken a significant step today in mastering the complex and beautiful anatomy of the kidney. We've journeyed from its place in the abdomen, through its protective layers, into its functional core, and followed the rivers of blood that sustain it. Remember that what you've learned is not just a list of names and places. It is the architectural blueprint for one of the body's most vital systems. This knowledge is the bedrock upon which you will build your understanding of physiology, pathology, pharmacology, and clinical practice. It's a language you will speak for the rest of your medical career. As you move forward in your studies, I encourage you to be an active learner. Don't just passively read textbooks or watch videos. Engage with the material. Draw the diagrams we discussed until you can do it from memory. Use flashcards. Explain the concepts out loud to a friend, or even to your reflection in the mirror. Teaching is one of the best ways to learn. Find clinical correlations for every anatomical structure you learn. Ask yourself, what would happen if this artery were blocked? Or what symptoms would a patient have if this part of the kidney was damaged? This makes the information stick. The path through medical school is a marathon, not a sprint. There will be times when the sheer volume of information feels overwhelming. That is completely normal. In those moments, remember why you started this journey: to help people, to heal, and to make a difference. Every fact you learn, every pathway you memorize, is a tool you are adding to your future clinical toolkit. Mastering kidney anatomy is one of those essential tools. Be patient with yourself, celebrate small victories, and never lose your curiosity. The human body is the most incredible machine ever created, and you have the privilege of learning its secrets. Keep pushing forward with that same energy and enthusiasm. Your future patients are counting on the knowledge you are building today. If you found this guide helpful and want to continue learning with us, be sure to check out more content from Joen Academy. We are dedicated to making medical education simple, engaging, and effective for students just like you. Keep up the fantastic work, stay curious, and I'll see you in the next lesson. You've got this.